Good morning, and thank you for attending another webinar with at Messer Financial Group. Today, we're thrilled to have Robin Deppenbrock with Pivot Health. They are a short-term medical company that we just got a contract with. Robin's been in the industry for about 20 years, and she's been with Pivot Health since 2017. And she's going to go over the product offerings that Pivot Health has to offer to our Messer agents. So, Robin, without any further ado, I'll give you the floor.
Great, thank you so much. Thank you and good morning, everybody. Thank you for being here. I'm going to get right into it. Again, my name is Robin Deppenbrock. I'm Director of Agency Services at Pivot Health. And first, I'm just going to give you a little overview of who Pivot Health is. You know, in my bio, I started with Pivot Health in 2017. Well, Pivot Health actually launched their first products in 2016. So I'm one of the pioneers, so to speak, of the company. Even though, and Pivot Health is not an insurance company. So Pivot Health is a product development, management, and marketing company, providing alternative insurance solutions to the individual market. So basically, Pivot Health creates a product, does all the filings and the rating, and then they take that product and they bring various carrier partners and vendors together to bring that product to market. So we launched our first products in 2016. And 2018, we were acquired by a company called healthcare.com. They're ranked 583 on 2019 Inc. 5,000 fastest growing companies. And basically they are a lead generation comparison company, technology company. So we quickly entered the insurtech market as one of the biggest leaders in insurtech. So we have two main business units. We have our comparison business, which is our technology, healthcare.com, and then we have our coverage business, which is Pivot Health. Together, we are creating an best-in-class customer journey from comparing products all the way through issue, and we're going to even take that further as far as their experience as far as being a member. So lots more to come regarding technology and consumer experience. We have three major goals at Pivot Health. One is to be the best-in-class technology support for agents. The other is to bring differentiating products to the market. Our products, we feel, serve specific niches in the market. Short-term medical is a niche product. Not everybody, it's not for everybody. There's underwriting questions, there's pre-existing condition limitations, so it's not for everybody, but we feel that we've positioned our products and our product continuum to bring it to specific niches in the market that have specific needs. And then the last one, of course, is to be the lead in the industry in agent support and customer service. So I like to show this visual about Pivot Health and kind of our partners and our products, because I think this brings it together a little bit more for everybody. So Pivot Health products is like the seat of the three-legged stool. So you have the insurance administrator, which is insurance benefit administrators, or you may know them as Allied National. They do all of our customer service, billing, and claims payment. Then you have the insurance carriers behind our products. We are very happy and proud to have all A-rated companies behind our products. Companion Life has been our insurer of our short-term medical products since 2016. They continue to be a big player with our products. We just recently brought on a new insurance company for a new product that we have, which is the North River Insurance Company. And then we have various other carriers behind other products. And then we also have relationships with networks so that we're able to provide network access for certain plans. So whether it's a Cigna network or First Health network, and then a PBM, which is Surpass PBM that we use for our benefits. Now, when I say that short-term medical is kind of a niche product, one of the niches that we have invested a lot of time and kind of product development is in that pre-Medicare market, that 60 to 64 age market. And there's a lot of reasons why we did it. One is the market itself. So 12 million people out of 77 million baby boomers are between the ages of 61 and a half and 64 and a half. So that's about 28% of that population. That's a huge population. You hear every single day, if you sell Medicare, 10,000 people are turning 65 every day. Well, guess what? 10,000 people are turning 60, 61, 62, 63, and 64 every day because it's a generation, and that's going to happen for the next 10 years. So this is a, a population that's going to continue to grow. Then we also saw that this population really had nowhere to go. There were agents that sold under 65 products, didn't really want to deal with that 60 to 64 age market, because they thought they don't make enough money, or there's only ACAs, the only thing that's available to them. They're probably sick, or have some type of illness that won't allow them to get through underwriting. And if you sell over 65, you've been across that table when that one person, your Medicare recipient, is getting Medicare and their spouse is only 62 and 63, really don't know where else to put them but ACA. So that's why we really started focusing on this market. We also saw that 45% of baby boomers consider themselves entrepreneurs. About 20% of entrepreneurs are between the ages of 50 and 65. So people are retiring and going on to do something else, something they love, something they have passion for. 50% of this market are ineligible for subsidies. So they're paying a lot of money either on COBRA or on ACA for their insurance. And then we looked at our membership alone. Now we have underwriting questions. There's 5 simplified underwriting questions, accept or reject on the spot. But, I always tell this joke. When you turn 50, you kind of fall apart. You have more aches and pains, probably go to the doctor a little bit more. But when you get to 60, you kind of pull yourself together. If you do have something that you're being treated for, it's probably something that you're maintaining, and you have a maintenance drug or diet plan or exercise plan that you're doing. So we found that our population within Pivot Health for the 60 plus went from 9% 2019 to 16% this year. So we had a tremendous growth in that market. One of the products that we brought to market was called Bridge to Medicare. Now, Bridge to Medicare is a 3-year short term product that's only available for age 60 to 64 in 11 months. It's great for someone who's self employed that's 60 plus, a spouse of a Medicare recipient that's 60 plus, or someone who wants to retire but is afraid they can't afford health care. It's a great alternative to ACA. And what it is, there's 3 plan designs in the Bridge to Medicare, and basically the deductibles are 10,000, 7,500, or 5,000. And then you'll see the coverage maximum is 250, 500, or 500,000. Now you may think, oh, that's not a lot, but remember, this is a 3-year plan, so that starts over every single year. And then everything really goes towards deductible and coinsurance. Their doctor office visit, hospitalization. There is a prescription drug benefit on each plan. So, real nice plan to get them to Medicare. It's going to be about 40 to 45% less than ACA and COBRA. So, what we do is we issue up to 364-day plans, and every time one policy ends, the next one will start automatically. There's no new underwriting. They don't have to attest that they have had no health changes. And the nice thing is that if a condition arises within that first or second policy and it's deemed a covered condition, that will be covered as any other illness in the subsequent policies. There's no network restrictions on this plan, and there's no pre-ex look back. So that's where that that condition will be covered in the subsequent policy. The deductibles and coinsurance maximums start over every year, but so do the prescription drug copays, and the coverage maximums start over every year. So I had mentioned that one of the benefits of this plan is no network restrictions. There's no networks they have to go. Very similar, MedSup, there's no network, so you can go to any provider. So the member can go to any provider. And what Pivot does is we pay a percent of Medicare allowable, and we pay physicians 125% of Medicare allowable, and facilities 150% of Medicare allowable. Now, your client is going to get an ID card when they get issued. They're going to get an ID card just like any other insurance. On that ID card is a benefit verification number that we urge and tell clients to have their provider call. The provider will call that benefit verification line, verify benefits, and find out how they're going to get paid. The provider will submit claims to insurance benefit administrators for processing. Claims are repriced according to the percent of Medicare allowable, and then the amount paid to the provider will show as a discount on the EOB to the member. That discount on average, based on our Medicare allowable payments, it's going to come to about a 68% discount on average. Now, a network discount is anywhere between 30 and 35%. And what the difference is that network discounts are discounting off the retail price. Well, a provider can charge up to, in some areas, 900% above Medicare. So that 30% off that retail price is still going to be a pretty heavy out of pocket for that member. What we do is we're going to pay more than Medicare. So we start at kind of the wholesale price and we pay a little bit more. And that difference equates on average to about 68% discount for the member for their out-of-pocket expenses. We also offer a balance bill protection. So a lot of times when we talk about this plan of reference-based pricing, usual and customary repricing for claims, people always think balance bill. Well, what we do is we offer balance bill protection. So we can't guarantee that your client's not going to receive a balance bill, but what we do say is if they receive a balance bill, they can send that balance bill to insurance benefit administrators, and they have a team of negotiators that will negotiate that bill with that provider to get to a reasonable fee for that service. Anything above what the insured has already paid and that is stated as their responsibility within their certificate and schedule of benefits, once that's satisfied, they don't have to pay anything more than that. So that Pivot will pay the provider anything above what the insured's responsibility is. So it's a real nice protection for you to be able to offer your clients. So really it's a win-win-win for them because they're saving on premium because there's no PPO access fee. They're saving on their out-of-pocket claims expenses because it's a higher discount on average, 68%. And then they have that balance bill protection. And this just gives you an idea of the savings that we have on the repricing. It also shows you the percent of appeals that we have is very, very low. So providers are taking the reference-based pricing or the Medicare Plus, we like to call it, reimbursement because it's more than Medicare. So they're happy with that. So you see here that 95% of the claims went through, only 1% of the appeals had to be paid at retail price. So still a savings for the client. The Bridge to Medicare plan has added association benefits through Communicating for America. There's a telemedicine doctor on demand, so they can use the telemedicine benefit whenever they want. There's a $49 fee, but if they send in their receipt, they'll be reimbursed that $49. There's a discount on prescription drugs and also a discount on vision and audiology. So Bridge to Medicare was a great product when we introduced it about 2 years ago, really opened up this 60 plus market and the mindset, especially of Medicare agents, because they now have a solution for that spouse that's sitting across the table that is either going to be staying on COBRA, still working, or is going to ACA and paying a lot of money. Now, this is the Bridge to Medicare state availability. We have about 10 states, and this is where the 3-year short-term medical plan. What we found is that the Bridge to Medicare product was a great product, but we found that also brought into a 60 plus strategy. And that allowed us to bring all of our short-term medical products to the 60 plus market. So what we looked at some sales data from last year, we saw that there was a big increase in the 56 to 64 age group that were buying short-term medical products. You'll see the 28% is that age 26 to 35. That's probably, you probably would expect that for a short-term product. But look at the black area where it's 19% between 56 and 64 age. Last year, we saw a 63% increase in our policies for age 60 to 64. So by introducing the Bridge to Medicare plan, we actually introduced a 60 plus strategy. So with that, Bridge to Medicare is our only 3 by 364 day plan that we have, and that's eligible for age 60 to 64 in 11 months. But all of our other short-term products go from age 6 months all the way up to 64 and 11 months. And you'll see the orange where we can add a couple of states that will give you Bridge to Medicare and 364. You'll see the blue states are our Bridge to Medicare 364 and our Pivot Care Elite plan, which is a fixed indemnity plan. So now your extended durations or your 2 by 364, your states are getting wider and wider. And you may have somebody who's 64, they're going to be 65, in 9 months, 10 months, they just want a 1-year policy. So again, it broadened up our product portfolio for this age group. All of our extended durations that we have work the same way. So all policies are kind of issued at the same time, whether it's 2 by 364 or 3 by 64. When one policy ends, the next one starts automatically. As long as premium is paid, that policy is going to start that very next day. And with that, everything starts over. So all your deductibles start over, all your copays start over, your out-of-pockets start over, but also your coverage maximum starts over. And that's important too, because that can help with premium. You could give somebody a lower coverage max because it's going to start over every year. And there's no new underwriting when the subsequent policies start. There's no new waiting periods. And again, there's no new pre-ex look back. So if a condition arises in that first year, it would be deemed as covered as any other illness on the subsequent policies. So what makes the Pivot Health short-term unique? There's an array of plan options that fits any client's needs or budgets. I'm going to show you these plan designs, and you're going to see there's from the very basic plan, everything's deductible and coinsurance, all the way up to a very rich plan, very nice COBRA alternative that provides preventative and wellness benefits and all that included in the plan. The Bridge to Medicare is the 3 by 364. We have plans that have access to large national networks, the Cigna network and First Health network. And then we also have the open access plans, the ones that we talked about for Bridge to Medicare. There's innovative plan designs and features that kind of set us apart. All of our insurance products are backed by A or A+ carriers. And we also have additional association benefits through Communicating for America. Now, remember I showed you that 3-legged stool. So the plans I'm going to go over now, the short-term plans that we have, the Core, Classic, Quantum, Bridge to Medicare I just went over. These plans are all underwritten by Companion Life. Companion Life's been in the market for over 40 years, A+ rated. The non-insurance member benefits, telemedicine, discounts on prescriptions and vision, all of that comes through member benefits that are provided by Communicating for America. The Quantum plans and the Epic plans utilize the Cigna network. The Core plans access First Health network. And all of our short-term medical plans are administered by insurance benefit administrators. So real quick, I'm going to give you an overview of all the other products just so you know how they kind of fit within our niches that we talked about earlier. The core plan is a short-term health plan that has very low deductibles, low coinsurance out of pocket. And when you see coinsurance out of pocket on our plans, that means the deductible is not included in that out of pocket. So you see the low deductibles, low coinsurance, pocket out of maximum. They have 3 doctor office visit copays. There's the primary at $30 and urgent care and specialty at $60. Now this plan we kind of brought to market to attract the younger generation. We wanted really for the child only because we can have child only policies. You could be 6 months old and have your own policy. We also have children policies, so you can put multiple children, siblings on one policy. And this was for this kind of invincible crowd, never going to get, need anything more than to go to the doctor. I just want to pay my copay and go to the doctor. There's a prescription drug benefit on here if they want to use that as well. Now, this plan does have limited hospitalization benefits. It's a lighter plan. So the hospitalization benefits pay up to a certain dollar amount, and then that dollar, anything above that dollar amount is considered not covered. Now, those plans were really put out there for, again, that younger generation. Our membership on those plans, 53% are less than age 35. So we really kind of created that plan for that market, and that's the market that's attracted to it. The classic plans, these are the plans that we came out with in 2016. They continue to be our top selling plans. Again, an array of plan designs that you can offer your clients. You'll see the different choices of coinsurance and deductibles. Plans have copays and prescription drug benefits. Some have discount RX cards. I can tell you that our number one plan, and it has been since 2016, is the Choice $5,000 deductible with a $1 million coverage max. It is a great price point at the 80/20. It's a great price point. It has doctor office visit copays and an RX discount card. Now, as we had mentioned earlier, we had a rise in that 60 to 64 age group. Not only were they going for the bridge to Medicare, but we found that we had a big increase in policy for that age group on the economy plan. The economy plan is your bare bones plan. Everything goes towards the deductible and coinsurance. I mean, hospitalization's covered towards deductible and coinsurance, but there's no doctor office visits, copays, there's no prescription drug rider. But what we found is that people were really going for that low price point. They felt like they could self-insure the deductible, they could self-insure the out-of-pocket. Maybe they only needed a couple months before they were getting to Medicare. But we found on the economy plan, people were choosing a $10,000 deductible at a 70/30 coinsurance with a $100,000 max coverage. So again, just something to get them to Medicare is what they're looking for. Our deluxe plan continues to be a top seller as well. This is kind of our higher end classic plan. It has deductibles, lower deductibles, doctor office visit copays, and prescription drug coverage. So the economy plan, as I mentioned, 42% of the memberships are age 61 to 64. And these are our top selling states. We are very competitive in Texas and Georgia and Florida. The EPIC plans, these are new plans. We just rolled these out in the last couple of weeks. These EPIC plans are underwritten by the North River Insurance Company, which is an affiliate of Crum & Forster. The non-association member benefits are provided by Communicating for America. On these plans, the telemedicine benefit, which is included, is free. There's no copay to the telemedicine benefit. They can use it as much as they want, and it's a free benefit. The PPO plan utilizes the Cigna network, and again, these are administered at insurance benefit administrators. This gives you an idea of the plans. There's 2 plans. You have the EPIC PPO plan. That's going to be your plan that utilizes the Cigna network. It has the added benefit of mental health and substance abuse benefit built in. Your Epic base plan is going to be where you can play with your premium a little bit. There's higher deductibles. You could do a higher deductible and have an opportunity to add another product, a supplemental or a fixed indemnity to help with the out-of-pocket expenses. The Epic base plan is all provider access, or that same reference-based pricing that we talked about on the bridge to Medicare. It's freedom of choice. They can go to any doctor they want. A couple of nice features on this is that there is a preventative exam. You have to have a 3-month wait, but then there's one primary visit that's covered 100% up to $100. These are 100% coinsurance plans. Once the deductible is satisfied, the coinsurance is zero. So it's covered at 100%. There's travel, not that you're going to use that much right now, but maybe in the future. There's travel, there's on the PPO plan, there's coverage for traveling into a foreign country if someone needs immediate assistance. There's an optional supplemental accident plan that you can add to help offset the deductible, and you can either do a $5,000 or $10,000. There's a prescription drug benefit that's optional that gives you the copays of $5, $35, or $70. There's no deductible that has to be met, but 6 months and less, there's a $1,000 cap to that, and over 6 months, there's a $2,000 cap. Now, again, if you extend coverage, every new policy that is going to start over. And again, the PPO plans utilize the Cigna network. The base plans are open access, or they can go anywhere. So what makes the Epic plans unique? 100% co-insurance plans, free and unlimited telemedicine benefit, access to the Cigna PPO network on the PPO plan, the Epic base plan, which utilizes reference-based pricing, and also a great alternative for premium savings. Plans with $5,000 out-of-pocket maximums available. Remember, if they choose a $5,000 deductible, they satisfy that deductible, they're at 100% coinsurance at that point. Optional prescription drug benefit, preventative care coverage, optional supplemental accident rider, and then again, travel outside the country. Now, our top plans that are really exciting to talk about. These are our quantum plans, great COBRA alternatives. They are going to look most like a group plan, so someone will feel comfortable going from a group plan to these plans. You'll see here there's 2 plans, a PPO, high deductible PPO, and a copay plan. Again, you can get, if you choose a $10,000 deductible, you can get 100% coinsurance on that plan. Preventative health, there's a 1 visit per period is covered at $250. All the wellness is also has coverage, so it's all subject to deductible and coinsurance, but it's included in the plan. It has the prescription drug benefit is on the Quantum PPO copay plan. And again, it's the $5, $35, and $75. There is an organ or tissue transplant coverage if you utilize the Cigna network. There's traveling in the U.S., there's coverage subject to deductible, traveling outside the U.S. subject to deductible and coinsurance. And then there's a built-in supplemental accident benefit that will pay for the patients 100% of their deductible, whatever they have left. So what makes these plans unique? 100% coinsurance available, Cigna PPO in-network, that reference-based pricing I had talked about earlier is out-of-network, supplemental accident built in, preventative health, wellness, organ transplant coverage. We're seeing a higher number of families going towards this plan, purchasing this plan. And that's really what we created for. We created for the COBRA alternative, and we created to increase the population of families membership that we have. So again, just to go over kind of the networks, the Quantum and the Epic utilize the Cigna network. Core utilizes the First Health Network. Classic, Bridge to Medicare, and Epic Base utilize open access or freedom of choice. So that's kind of our short-term under 65 product portfolio, going from really 6 months all the way up to Medicare. We also have a very nice fixed indemnity product that's available, dental, vision, and supplemental. Our Pivot Care Elite plan is a no deductible co-insurance or no co-insurance plan. It has plans based on the plan that you choose that will provide benefits $3,000 to $6,000 a day for inpatient hospitalization. There's a ICU benefit, $6,000 to $12,000 a day for 30 days. There's a critical illness rider built into the plan. There's accidental death built into the plan. There's a wellness that pays up to $125, and there are additional benefits for fractures, dislocation, burns, and more. So this is a indemnity plan. This is a you can have the payment. So it's a fee for service. It says exactly what it's going to pay for that service. That money can be paid to the insured or directly to the doctor, and whether it's more or less than what the charge is, it's going to pay exactly that amount of money. We have 5 plans, and Plan 1 is the top selling plan. The average premium is $122. Remember, I said that that Epic base plan had higher deductibles, $15,000, $20,000 deductible. Well, this is a nice plan to be able to add alongside it to help offset that out of pocket. And then finally, we have a add-on dental product through Renaissance Dental with an optional vision through VSP. There's no waiting periods for any benefits. And basically, it's a progressive plan. So the benefits start somewhat low in the first year and then get progressively better second and third year. Our high plan includes child ortho. Routine cleanings are paid at 100%. Basic services include fillings, sealants, and extractions. Major services include crowns, oral surgery, and implants. Very rich dental plan. And 52% of dental is sold with vision. And you see the average premium here is $59. And then finally, our Latitude is our supplemental product, and basically it's a packaged critical illness, accident, ADD, hospital indemnity plan. This is a check the box add-on to our short term as well as a standalone plan. It's guaranteed issue, and benefits are paid to the insured. And basically it's a $2,500 benefit or a $5,000 benefit. And you'll see here the preferred plan, the average premium is $54 per month. And last but not least, I'm not going to go into this in too much detail because we do have a senior sales manager that will hopefully be providing you a webinar in the future. But now that we have that progression going into that pre-Medicare, we naturally have the 65 plus MedSup product. It's through Pan American Life Insurance Group. In 22 countries, it's rated AM Best. A by AM Best in 2019 and A by Fitch in 2020. We are offering the A, F, G, and N plans. As you know, MedSup plans are all the same. They're available in 29 states. What we do offer, which is a bit unique, is that our household discount goes up to 12% in a lot of states. And it's also very flexible. So in most states, all you have to do is have someone who is 55 or older living in your household. They don't have to have an application. They don't have to have a policy. They just need to be living in the household to get that. It's not in every state, but it is in most states. It's a simple e-app that you can do. It takes about 15 minutes. You can do an e-signature or you can do telephone signature. And there's no AHIP certification. It also is on the spot underwriting. So you'll know right away if it's issued or declined. This is the state footprint. It's extensive state footprint. All the blue is approved. And this kind of gives you an idea of the blue, the darker blue, kind of shows you where we're most competitive. And it goes by the shade of blue. Missouri, we're not marketing in today. In Florida, we need to work on Florida and and really get into those areas where we are competitive, but we do have the product there as well. So that kind of sums up our products through Pivot Health. And I hope I didn't talk too fast and you got some information, but I will take any questions that anybody has as well.
Thank you, Robin. That was a lot of wonderful information. And right now, let's see if we have any questions from the audience. I do have one question. When or will this product be available in the Carolinas?
So the Classic and Core and Quantum Plan are, hold on one sec, Carolinas. North Carolina, we have the Classic and Core plan available there in the Pivot Care Elite. In South Carolina, we have the Epic plan available in the Pivot Care Elite plan.
Okay, thank you for that information.
Mm-hmm.
Are there any more questions for Robin? Hold on, let's see. Had a question about the Medicare supplement, but you talked about that. Robin, will you be able to share copies of the slides to everybody?
Sure. I'll send it. Yeah, I'll send it off to you guys and you can send it out.
You might have touched on this already. So is the core plan more like a hospital indemnity plan?
It's not. It's a short-term medical plan. It's just that it pays up to a certain amount, and then that anything above that amount is not covered. So that hospitalization, it's not a reimbursement or anything like that. It pays up to that amount, and then it is considered not covered.
Okay, another question about the Medicare supplement, which you answered. Just double check and make sure I got all the questions. Core plan, hospital indemnity. That seems to be about it. Oh, when will the
Great.
bridge to Medicare be in North Carolina?
We are actively filing in all the states. So I don't really know when, but we will let you know as soon as it's available.
Do you mind going over the deductibles once again?
Sure. So on the Bridge to Medicare and the Classic and Core plans, the deductibles are not included in the coinsurance out-of-pocket maximum. So the deductible is in addition to the coinsurance out-of-pocket maximum. On the Epic and Quantum plan, this is kind of confusing, but the Epic and Quantum plan, the deductible is included in the out-of-pocket. So if you have a 100% coinsurance plan, like the Epic plans are all 100% coinsurance plans, the Quantum plan, you can buy a 100% coinsurance plan. Once that deductible is satisfied, then it pays at your plan pays at 100%. So for the Epic plan, you can actually choose a $5,000 deductible. Once that deductible is satisfied, then your plan pays at 100%.
You want to talk about the enrollment in the app process?
Sure. So once, you should contact Messer for your contracting. Once you're contracted, you'll receive your own personal URL, or Pearl, some people call it. It's a customized URL that has your writing number in it. It'll have your name on the quoting platform. And basically it is quote and enroll all online. All the fulfillment is online. So once you choose a quote, once you put your quoting information, we don't ask for social security number on the short-term medical. We only ask for zip code, date of birth, and the person's name at the beginning. Then you pick a plan. You can extend coverage once you pick a plan. You can add the ancillary products once you choose a plan. And then once you have all your products in your cart, you just start your application. And then there's 5 simplified underwriting questions. The applicant answers no to all the questions, they're issued on the spot. If they answer yes to any of the questions, then they'll be not eligible for the product. From there, you basically add the billing information. It's either credit card or or electronic fund transfer from your checking account, and you put that information in, hit submit, and then it's issued, and you can start as soon as the next day. So you can start as soon as tomorrow, or you can do a effective date 60 days in advance.
Okay, currently Pivot Health and Pan American are available to contract on our Insurance Bay, our Sure LC website. So you can request those contracts now. I think there's one more question.
hmm
Is healthcare.com lead generating available to Pivot Health?
Or you mean the agents for Pivot Health? That you would have to contact healthcare.com. We don't have any type of lead program that we provide.
All right. Thanks, everybody. Thank you, Robin, for your time. Thanks,
Sure,
everybody
thank
who
you.
attended the webinar for your time. We greatly appreciate that. And we'll send out information along with the slides and everything and some more information about today. Thank you for your time and have a great day.
Thank you.
You're welcome. Thank you.